Hello everybody, this is Diana Menezes and I'm one of the OET tutors working at MedCity International Academy. So today I've come up with an important topic that everybody, they feel it a lot of difficult, especially while speaking, while you're dealing with, reluctant or difficult patients. So today I'm here in order to explain you how you have to deal and how you have to talk to the interlocutor in order to attain a B grade when you get reluctant or difficult patients to deal with. So let's come to the board. Now, as you can see that the interlocutor may have different roles. So he might be playing a role of the patient. Maybe he is a caretaker who is talking to you, or it could be a guardian or a parent, or it could be also a visitor, or the interlocutor can play different roles according to the the role play card that has been given to them. Now, in this particular category of difficult clients, where we can also include reluctant patients, these include, for example, teenager or psychiatric patients. So when you deal with a patient who is like 18-year-old or a person who is having some psychological problems, it would be really difficult in order to convince them. And another thing is that we can also see the terminally illness. So the terminal illness is something where the patient will be much more depressed. It could be like something the patient is suffering from cancer, or maybe a kidney disorder, or the patient maybe in any condition has got a poor prognosis, or it could be in some cases like the patient is having an extreme pain and you are attending the client very lately, or it could be also patients with depression. For example, like they have lost somebody, someone who is very close to them, and they don't want to open up to you. So these are a few clients which you may encounter, like the interlocutor may play the role of this particular clients, and it would be a little bit difficult and tricky for you to convince these kind of patients. Okay, so now there are a few steps to deal with this. Basically, we have got two important criterias. We have got the linguistic criterias as well as the communicative criterias to deal with the patients. Now, at this particular point where you are having reluctant or you are having maybe the difficult clients, so here the communicative criteria plays a very important role. The full focus of your role play should switch to the communicative criteria rather than focusing on the linguistic criteria. So let's see the first thing. Imagine that you are going into a room and the patient is really very angry because you have not attended the patient for maybe for about 30 minutes and he has been continuously ringing the bell, and you are going in order to ask him regarding what is happening and why did he call you to the bedside. So it is really very tricky because the moment you enter, the patient is going to react to you in a very bad way. So here you greet the client with an empathetic manner. You go and say the client that you introduce yourself, saying that you are so and so and you have been working here as a registered nurse, and then you have to ask the client that I think that you called me, how can I help you? So at this, do not ask like I think you are angry, because it wouldn't be a correct way of introducing, because you just cannot sense that the patient is angry until and unless you talk to him or her. So the next thing is you have to apologize for the mistake that has happened from your side. For example, at this particular situation, you might be saying that the client is going to complain you that you have not attended him, he's having an extreme pain, and at this case you will be saying that I apologize, or I'm extremely sorry that you had to wait for this long, and then you have to explain the reason. Now this particular reason will be given in your card in brackets, like what you have to exactly explain and what was the situation that did not allow you to take care of your client. Okay. And then you have to also reassure to the patient that I'll make sure that this particular thing doesn't repeat once again. This is something which is very important, because you can imagine the mental status of the client here, and that is what the first criteria of the communicative criteria says, that you have to empathize or you have to understand the patient's perspective. So all these 3 points are included in understanding the perspective of your client. The second thing that we have to focus is building trust. Trust is a very important component. If the patient or if the caretaker or whoever you're dealing with doesn't has this particular component or doesn't has a trustworthy relationship, I'm very sure that he or she will not open up to you. So it's a very important thing that you build your relationship, which is nothing but the next important criteria which comes under the communication is building relationship. So here you have to ask. Now the client is very angry. He may ask you to, I want to register a complaint against you, with your manager. So you have to convince the client to ventilate his or her feelings so that you can help him out. The next third important criteria is providing structure. Now, when we talk about providing structure, it basically focuses on one important thing, that is organizing your role play. You have to ask questions in an organized manner. Everything, you just cannot say that I'll provide you something and then again you come back and ask some questions related to what you were talking previously. This will be an haphazard way of doing the role play. So always also focus on providing a structure to what you're dealing with. The next important criteria is about the information gathering. The other way of saying is that about the history collection. Sometimes the card may not ask you in order to do certain history collection, but mind me, history collection is a very important part, because whenever in a normal setting we are going in the patient's room, the patient may tell you certain things, but in order to understand his situation or his condition in a better way, it's always very important to collect the history. Similarly, when you're doing the role play, as the OET people say, role play should be as natural as a normal setting. So history collection is really very important. You can collect the history, as in this case, as I was talking about the role play, you can ask the client that what is his pain score, and if you give him a rating of the pain score, you can also ask him what is the nature of the pain. You can also additionally inquire about was the medication in the morning given, is it effective enough. So all these things requires to be collected during the history collection, which is the fourth important element of the communication criteria. The next one is about giving the information, which is the final criteria of the communication. So here first we have to settle down the patient. The patient will be still a little bit annoyed, because sometimes the interlocutor's card can also say do not agree easily, or it can also say agree reluctantly. So that does mean that once again the interlocutor is not going to tell you an easy yes to whatever you are explaining. So here you require to settle down the patient. Tell him that this particular thing will not repeat again. Assure him that his pain will be controlled. We will be doing everything. He's in safe hands, and all these reassuring words requires to come out from your side. So here you settle down the patient and make all the necessary arrangements to provide solution. For example, you will be saying that you will be calling the doctor, or you can also ask the doctor to come and see the client. You can provide some comfortable position, and if the patient is asking you some strong painkiller, you can explain the client that this is out of my authority, but you can also tell the client that I can give you some ice pack application, or maybe some hot application. So it all depends upon what your card is exactly talking about, because nowadays during the role plays they give you everything in brackets, whatever you have to speak. The last thing is about the termination. Once you have finished, just don't end saying thank you, because that's not the way. Because you see, role play is nothing but it's an interpersonal communication, isn't it? So it's an interpersonal relationship. So when we talk about the interpersonal relationship, the last point or the last step of the IPR is terminating, isn't it? So it's really very important that you terminate the role play. So you can once again apologize that this particular thing was a mistake from our side, and we'll make sure that this thing doesn't happen again. And what I'll do next is I'll go to the counter and I'll immediately call the doctor and ask for any changes in your medication. So this would be the end of your role play. If you know what you have to do in order to deal with difficult clients, I would really assure you that it would be a smooth role play and a smooth thing, and you will be able to to attain a B grade in your speaking. So now the three important things that you have to keep in mind is about your tone. The patient is already very angry or maybe reluctant. You require a polite and humble tone. You have to use or be like, your voice should be really very soft when you're talking to these kind of patients. The next thing is about the reassurance. Listen to the client. The client is complaining. Don't give a response and interrupt the client's communication. You should allow the client to talk enough, okay? And then you can also say that I'm extremely sorry that because of me you had to go through this particular situation, or maybe the patient has got a poor prognosis. In that case, you will be sorry. You can say that, yes, I'm extremely sorry. If I was in your place, even I would have reacted in the same way, but you require to also provide solutions side by side. The last thing is about the persuasion. Now, in case of reluctant clients, or as well as along with the sort of terminally ill or depressed, it's really very important to persuade them. Persuasion is nothing but making the client to do something that we require. So this could be something like the whole concept of the persuasion depends upon the trust building. Once you build up that particular trust, the client will be always open up for more and more suggestions and more explanation from you. So this is how you have to deal with the difficult or the reluctant client. So for more information, please do visit MedCity International Academy. Thank you.